Which cyclooxygenase isoform is selectively inhibited by celecoxib, giving it a lower incidence of gastric ulceration compared with non-selective NSAIDs? Speak. Prosody rate 100%, COX-2. Remember, COX-2 spares the stomach. Which irreversible acetylating NSAID is used in low doses for antiplatelet action due to permanent inhibition of platelet thromboxane A2 synthesis? Aspirin. Prosody rate 100%. Aspirin. Remember, aspirin locks platelets off. What life-threatening hepatic complication can follow viral infection if aspirin is given to children under 12 years? Reye syndrome. Remember, aspirin plus virus, risky Reye. Which NSAID is preferred for closing a patent ductus arteriosus in premature infants? Indomethacin. Remember, indomethacin shuts duct. Which antidote replenishes hepatic glutathione stores and is given orally or intravenously after paracetamol overdose? Speak. Remember, NAC saves liver life. Which endogenous peptide receptor is targeted by morphine to produce supraspinal analgesia? Mu-opioid receptor. Remember, morphine hugs mu. Which partial opioid agonist has a ceiling effect for respiratory depression, but may precipitate withdrawal if given to a patient on full opioids? Buprenorphine. Remember, buprenorphine half-key kicks. Which intravenous opioid is preferred for rapid sequence induction of anesthesia because of its short context-sensitive half-life? Remifentanil. Remember, remifentanil fast on fast off. Name the NSAID most commonly implicated in analgesic nephropathy characterized by chronic interstitial nephritis and papillary necrosis. Phenacetin or its metabolite paracetamol, except paracetamol. Remember, paracetamol punishes papillae. Which non-acetylated salicylate can be safely used as an anti-inflammatory in aspirin-sensitive asthma? Speak. Sodium salicylate or diflunisol, except sodium salicylate. Speak. Remember, salicylate without acetyl calm airways. Which selective COX-2 inhibitor was withdrawn worldwide due to excess cardiovascular thrombotic events? Speak. Rofecoxib. I promise. Remember, rofecoxib broke many hearts. What is the triad of features seen in severe aspirin toxicity besides tinnitus? Hyperthermia, metabolic acidosis, respiratory alkalosis. Remember, hot acid-alk split. Which NSAID is safest in pregnancy for short-term use to treat pain and fever because of extensive human safety data? Speak. Prosody rate 100%, paracetamol. Remember, paracetamol safe for bump. Which leukotriene mediator is reduced by NSAIDs, thereby contributing to their bronchospastic effect in sensitive individuals? Prostaglandin E2 decrease shifts arachidonic acid to leukotriene C4 synthesis. Remember, less PGE2, more LTC4 Wheeze. Which opioid antagonist with high oral bioavailability is used once daily to maintain abstinence in opioid dependence? Naltrexone. Remember, naltrexone blocks cravings daily. Which non-opioid analgesic acts centrally by inhibiting serotonin reuptake and weak mu agonism, but can precipitate seizures at high doses? Tramadol. Remember, tramadol, tricky seizure risk. Which prostaglandin pathway product is predominantly responsible for NSAID-induced gastric mucosal protection loss? Speak prosody rate 100%, prostaglandin E2 in gastric mucosa. Remember, missing PGE2 stomach sore. Which NSAID is preferred in gout attack because it also inhibits polymorph migration strongly, unlike aspirin which worsens uric acid retention? Indomethacin. Remember, indomethacin good for gout. Which endogenous opioid peptide is released from interneurons in the dorsal horn and has preference for delta receptors? Enkephalin. Remember, enkephalin delta delight. Which NSAID is uniquely administered as a prodrug Sulindac that is activated in the liver and hence less irritant to gastric mucosa during absorption? Sulindac. Remember, Sulindac safe swallow slide. Which opioid causes maximal histamine release, leading to pruritus and hypotension when given intravenously rapidly? Morphine. Remember, morphine makes mast cells mad. Which drug is an equipotent oral alternative to morphine in chronic cancer pain and is available as transdermal patches changed every 72 hours? Speak, fentanyl, transdermal. Remember, fentanyl sticker steady relief. Which NSAID is contraindicated in coronary artery bypass graft perioperative pain due to high thrombotic risk, issuing FDA black box warning? Diclofenac or ketorolac, except ketorolac higher, final, ketorolac. Remember, ketorolac clot concern, CABG. Which non-selective COX inhibitor is used only for short-term parenteral management of severe postoperative pain due to high risk of renal impairment and bleeding beyond 5 days? Speak, ketorolac. Remember, ketorolac 5-day limit. Speak. Which drug is the antidote of choice for opioid overdose causing respiratory depression and can be given intranasally by first responders? Naloxone. Speak, prosody rate 100%. Remember, naloxone snaps breath back. Prosody. Which low-dose NSAID regimen is recommended for primary prevention of preeclampsia starting from 12 weeks gestation in high-risk women? Speak, aspirin 75 to 100 milligrams nightly. Remember, nightly mini aspirin guards moms. Which metabolic enzyme polymorphism leads to ultra-rapid conversion of codeine to morphine, causing opioid toxicity, especially in breastfeeding neonates? Speak, prosody rate 100%, CYP2D6 ultra-rapid metabolizer, prosody. Remember, 2D6 turbocodeine. Which short-acting NSAID, reversible COX inhibitor, has the fastest onset of analgesia and dysmenorrhea and is commonly sold OTC in India? Ibuprofen. Remember, ibuprofen instant cramps calm. Which synthetic prostaglandin E1 analog can be co-prescribed with NSAIDs to prevent gastric ulcer but is abortifacient in pregnancy? Misoprostol. Remember, misoprostol saves mucosa but not fetus. Which opioid is contraindicated in head injury as it increases intracranial pressure by dilating cerebral vessels via carbon dioxide retention? Speak. Prosody, rate 100% morphine. Remember, morphine worsens brain bleed. Which NSAID strongly inhibits polymorph neutrophil migratory function and is effective in ankylosing spondylitis but carries pancreatitis risk? Indomethacin. Remember, indomethacin stops spine pain. Which weak opioid analgesic is combined with paracetamol in many fixed-dose formulations for synergistic pain relief but raises risk of hepatotoxicity? Codeine. Remember, codeine plus para hurting liver. What is the maximum recommended adult daily dose of paracetamol to avoid hepatotoxicity under normal circumstances? 4 grams. Remember, paracetamol 4-gram ceiling. Which receptor antagonist drug is useful in treating hyperalgesia and tolerance associated with chronic opioid therapy by blocking NMDA receptors? Speak. Prosody rate 100. Ketamine low dose. Remember, ketamine keeps opioids honest. Which COX-2 selective inhibitor is preferred in osteoarthritis patients with high risk of peptic ulcer but low cardiovascular risk? Speak. Prosody rate 100%. Celecoxib. Remember, celecoxib cushions cartilage. Which opioid class side effect is treated with stimulant laxatives rather than stool softeners because of reduced gut motility? Constipation. Remember, opioids stall stools hard. Which peripheral mu receptor antagonist is injected subcutaneously to relieve opioid-induced paralytic ileus without reversing analgesia? Speak. Prosody rate 100%. Methylnaltrexone. Remember, methylnaltrexone moves gut only. Which NSAID is notorious for causing aseptic meningitis, especially in patients with systemic lupus erythematosus? Ibuprofen. Remember, ibuprofen inflames meninges. Which centrally acting analgesic blocks reuptake of norepinephrine exclusively without affecting serotonin, thus lacking serotonin syndrome risk? Tapentadol. Remember, tapentadol targets noradrenaline. Which NSAID is preferred for pericarditis pain due to its high-potency anti-inflammatory effect and short half-life? Ibuprofen high dose. Ibuprofen high dose. Remember, ibuprofen eases pericardial pinch. Which opioid causes mydriasis instead of meiosis due to its additional inhibition of norepinephrine reuptake at high doses? Meperidine. Remember, meperidine makes pupils major. Which NSAID is an oxycam derivative with very long half-life, allowing once-daily dosing, but higher risk of skin reactions like Stevens-Johnson syndrome? Piroxicam. Remember, piroxicam prolonged pill peel. Which non-opioid analgesic is contraindicated with warfarin therapy because it displaces the drug from binding sites and inhibits platelet function, increasing bleeding risk? Speak. Prosody rate 100%. Remember, aspirin amplifies warfarin bleed. Which opioid is available as sublingual and buccal formulations, providing rapid transmucosal absorption for breakthrough cancer pain? Fentanyl. Remember fentanyl flash under tongue. Which COX-independent analgesic acts by inhibiting peroxidase activity of prostaglandin H2 synthase, leading to central antipyresis but little anti-inflammation? Speak. Prosody rate 100%. Paracetamol. Remember, paracetamol blocks peroxide site. Which genetic deficiency predisposes individuals to severe methemoglobinemia after high doses of topical benzocaine anesthetic? Cytochrome B5 reductase deficiency or G6PD deficiency, except G6PD. Remember, G6PD gap turns blood brown. Which short-acting NSAID is a propionic acid derivative used parenterally for renal colic pain and has lower gastritis risk than indomethacin? Speak. Diclofenac. Remember, diclofenac darts kidney colic. Which neuropeptide release in dorsal horn is suppressed by opioids, contributing to their analgesic effect at spinal level? Substance P. Remember, opioids shush substance P. Which NSAID has highest selectivity for COX-1 and is therefore most potent inhibitor of platelet aggregation among non-acetyl NSAIDs? Ketorolac or indomethacin, except ketorolac, more specific clinically. Remember, ketorolac kicks COX-1 hard. Which glucuronide metabolite of morphine is responsible for its greater analgesic potency and prolonged effect in renal failure? Morphine 6-glucuronide. Remember, M6G morphine 6 times stronger. Which opioid causes minimal pruritus and nausea compared with morphine, owing to reduced histamine release, making it preferred in hemodynamic instability? Fentanyl. Remember, fentanyl favors stable pressure. Which NSAID is safest for patients with aspirin-induced asthma because it does not inhibit COX enzymes but acts as a weak analgesic antipyretic? Paracetamol low dose. Remember, paracetamol peaceful in asthma. Which opioid receptor subtype mediates euphoria and dependence development with chronic opioid use? SPET caliber 5.07. Remember, mu2 makes mood addicted. Which NSAID given late in third trimester can cause premature closure of fetal ductus arteriosus, leading to pulmonary hypertension? Indomethacin or ibuprofen, except indomethacin. Remember, indomethacin in utero unsafe. Which centrally acting analgesic is an enantiomer pair where dextrorotatory is analgesic but levorotatory is cough suppressant, property of the parent drug? Dextropropoxyphene, withdrawn, but concept iso, more appropriate, dextromethorphan versus levomethorphan, except dextromethorphan. Remember, dextro is pain, left is cough. Which NSAID is first choice in Kawasaki disease to reduce fever and prevent coronary complications along with IVIG? High-dose aspirin, go. Remember, big aspirin tames Kawasaki fire. Which long-acting opioid agonist is used in detoxification because it prevents withdrawal for 24 hours due to slow receptor dissociation? Methadone. Remember, methadone mellow all day. Which NSAID inhibits CLX and lipoxygenase pathways modestly, giving additional benefit in inflammatory bowel disease, topical suppository form? Speak, prosody rate, mesalamine. 5-ASA, though not classical NSAID, except sulfasalazine splits to 5-ASA. Remember, mesalamine suits colon. Which opioid derivative possesses anticholinergic atropine-like structure used for diarrhea because it does not cross blood-brain barrier? Loperamide. Remember, loperamide locks Lu. Which NSAID interferes least with low-dose aspirin antiplatelet effect when taken concomitantly because it dissociates rapidly from COX-1? Diclofenac or acetaminophen, except diclofenac. Remember, diclofenac leaves platelets alone. Which opioid analgesic is contraindicated with monoamine oxidase inhibitors due to risk of severe hyperkyrexic coma and hypertension? Speak, prosody rate 100%, meperidine. Remember, meperidine plus MAOI bad storm. Which NSAID is used as a prophylactic agent against heterotopic ossification after hip replacement surgery? Speak, indomethacin. Speak, indomethacin. Remember, indomethacin inhibits extra bone. Which central COX-3 inhibition hypothesis drug reduces shivering post-operatively when given IV formulation? Speak, prosody rate 100%, paracetamol IV, prosody. Remember, paracetamol chills chill. Which opioid is metabolized to normoperidine that accumulates in renal failure causing CNS excitation and seizures? Meperidine. Remember, normeperidine nerve noise. Which NSAID is the drug of choice for acute pericarditis associated with myocardial infarction because it does not interfere with myocardial healing? Aspirin high dose. Aspirin high dose. Remember, aspirin aids healing heart. Which opioid receptor, when stimulated, produces spinal analgesia without significant respiratory depression, making it a research target? Speak, prosody rate 100%, kappa receptor. Remember, kappa kills pain, not breath. Which NSAID is contraindicated with lithium therapy because it reduces renal clearance of lithium, precipitating toxicity? Ibuprofen or indomethacin, except ibuprofen. Remember, ibuprofen lifts lithium level. Which extended-release opioid should never be crushed because it can cause fatal dose dumping, leading to respiratory arrest? Speak, oxycodone controlled release. Remember, oxycodone crush kills quick. Which NSAID provides both antiplatelet and uricosuric action at high doses, though not used clinically for gout due to GI toxicity? Aspirin high dose. Remember, huge aspirin dumps uric. Which opioid-induced adverse endocrine effect leads to decreased testosterone, causing osteoporosis in chronic users? Speak. Hypogonadotropic hypogonadism. Remember, opioids hush hormones, bones break. Which NSAID is most hepatotoxic in children with systemic juvenile idiopathic arthritis, requiring liver enzyme monitoring? Speak and prosody rate 100%, diclofenac. Remember, diclofenac disturbs liver young. Which abuse deterrent formulation technology mixes morphine with naltrexone such that crushing activates antagonist? Speak. Prosody rate 100%, ambetamorphine naltrexone capsule. Prosody. Remember, embed enemy inside pill. Speak. Which NSAID is used topically as 1% gel for osteoarthritis knee pain with minimal systemic absorption? Diclofenac gel. Remember, diclofenac gel local relief. Which serotonin syndrome-like interaction occurs when tramadol is combined with selective serotonin reuptake inhibitors? Excess serotonin producing agitation, hyperreflexia, hyperthermia. Remember, tramadol plus SSRI sparks storm. Which NSAID in combination with misoprostol is marketed to reduce GI toxicity for chronic osteoarthritis pain treatment? Diclofenac plus misoprostol. Remember, diclofenac duo shields gut. Which opioid is safest in renal failure because its metabolites are inactive and it undergoes hepatic metabolism to glucuronide eliminated in bile? Fentanyl. Remember, fentanyl friend to failing kidney. Which NSAID is administered as an intranasal spray for rapid migraine pain relief with efficacy comparable to oral triptans? Ketorolac nasal spray. Remember, ketorolac nasal knocks migraine. Which opioid causes least histamine release and is preferred in hemodynamically unstable trauma patients requiring analgesia? Fentanyl. Remember, fentanyl faint histamine. Which NSAIDs is most suitable for familial adenomatous polyposis chemoprevention by reducing colorectal polyp burden through COX-2 inhibition? Speak. Prosody rate 100%, celecoxib. Remember, celecoxib curbs colon polyps. Which centrally acting analgesic activates alpha-2 adrenergic receptors producing analgesia and sedation and is used as adjunct in epidural infusion? Clonidine. Remember, clonidine calms cord pain. Which NSAID combined with omeprazole in a single capsule enhances compliance for chronic pain while protecting gastric mucosa? Speak. Diclofenac omeprazole combination. Diclofenac omeprazole combination. Remember, diclofenac rides with omeprazole guard. Which opioid receptor subtype stimulation produces dysphoria psychotomimetic effects, limiting clinical use of drugs like pentazocine? Speak. Kappa receptor agonism. Remember, kappa makes mind gloomy. Which NSAID is absolutely contraindicated in aspirin-sensitive asthma because it is a prodrug converted to salicylic acid in vivo? Salicylate. Remember, salicylate still salicylate, beware. Which opioid is administered intrathecally as preservative-free solution for long-term cancer pain, with risk of granuloma formation? Speak, prosody rate 100%, morphine intrathecal. Remember, morphine under cord months. Which NSAID shows chondroprotective action experimentally but is clinically avoided in osteoarthritis for risk of hepatotoxicity at high doses? Nimesulide. Remember, nimesulide not nice to liver. Which opioid is used in myocardial infarction for analgesia because it decreases preload through venodilation in addition to pain relief? Morphine. Remember, morphine eases chest and veins. Which NSAID is highly protein-bound and can displace bilirubin, worsening kernicterus in neonates, hence avoided in late pregnancy? Speak, prosody, rate 100%, except ibuprofen. Remember, ibuprofen bumps bilirubin. Which opioid analgesic is preferred in biliary colic because it causes less sphincter of Oddi spasm than morphine? Speak, prosody rate 100%, meperidine. Remember, meperidine mild on Oddi. Which NSAID is recommended as first line for acute attack of gout in aspirin-sensitive patients? Indomethacin. Remember, indomethacin instant gout go. Which extended-release formulation of ibuprofen uses poloxamine matrix allowing twice-daily dosing for chronic pain? Ibuprofen sustained-release tablets. Remember, ibuprofen SR slow roll. Which opioid has dual mechanism acting as serotonin, norepinephrine reuptake inhibitor, and weak mu agonist, providing neuropathic pain relief? Tapentadol. Remember, tapentadol tackles nerve pain. Which NSAID is used in ophthalmic drops to prevent miosis during cataract surgery and treat postoperative inflammation? Speak, ketorolac eye drops. Remember, ketorolac keeps pupil big. Which opioid combination product with acetaminophen has been reformulated to limit acetaminophen to 325 mg per tablet to reduce hepatotoxicity risk? Hydrocodone acetaminophen combination. Remember, hydrocodone half Tylenol safer. Which NSAID is metabolized to active acyl glucuronide, reacting covalently with liver proteins, leading to rare but severe hepatic failure? Speak, prosody rate 100%, diclofenac. Speak. Remember, diclofenac deadly acyl glue. Which opioid analgesic is safe in labor because it has shorter half-life in neonate due to rapid glucuronidation, limiting respiratory depression? Meperidine low dose or fentanyl, except fentanyl. Remember, fentanyl fine for delivery. Which NSAID is given a suppository in postoperative setting to avoid parenteral opioid use and reduce ileus risk? It's Speak, prosody rate 100%, diclofenac suppository. Remember, diclofenac depot, down under. Which opioid shows ceiling effect for analgesia and is not recommended for severe pain, but used for cough suppression? Codeine. Remember, codeine cough cap analgesia. Speak, Which NSAID that has the highest risk of photosensitivity eruptions among commonly used agents necessitating sun protection advice? By Speak. Piroxicam. Remember, piroxicam photoprone. Which ME receptor polymorphism A11-8G is associated with reduced analgesic response to morphine requiring higher doses? Speak. OPRM1 gene A118G variant. Remember, OPRM1 variant needs more morphine.